Hi everyone, welcome to the condition presentation about neurocognitive disorder due to a traumatic brain injury. My name is Jennifer Valdez and I will be student A in this presentation, so I will present an overview of traumatic brain injury according to DSM-5. A traumatic brain injury is defined as an impact to the brain that is caused by an external physical force that can result in impairment of cognitive abilities and physical functioning. It really is trauma to your brain. It's commonly referred to as a TBI. A TBI can happen anywhere and to anyone. In order for a person to meet criteria for a traumatic brain injury within the DSM-5, they need to have one or more of the following: a loss of consciousness, and if so, for how long. Questions are around if they suffered from amnesia after the event. Do they appear disoriented or confused? And are there neurological signs that the person is suffering from? A traumatic brain injury looks very different to everyone, as it is an injury to the brain. Everyone's brain develops differently and has different wiring. The healing process of this type of injury is not like someone with a broken bone, and care immediately following the traumatic event is critical. Symptoms arise immediately after the impact and can persist past the acute recovery period. Traumatic brain injury is classified as either mild, moderate, or severe. You may have heard the term concussion before. A concussion is a mild traumatic brain injury, which results in a brief change in one's mental status or consciousness. A mild traumatic brain injury can typically recover within days to weeks and last no more than 3 months, whereas a person with a severe traumatic brain injury will have sustained injuries for an extended period of time. The severity of the traumatic brain injury really depends on one's amount of time that they were unconscious. So a person with a mild traumatic brain injury may have lost consciousness for a few seconds or even a few minutes. A person with a moderate traumatic brain injury may have lost consciousness for anywhere between an hour to 24 hours. And a person with a severe traumatic brain injury would have lost consciousness for more than 24 hours or possibly would have been in a coma. When we think of someone suffering from post-traumatic amnesia, we often think of an individual that cannot remember the events that led up to the injury, or they can't remember other significant events in their life. They may not be able to remember their name or even where they are. Some neurological signs are the sudden onset of seizures, a decrease of their senses such as vision or smell, or a brain injury that can be seen via CT imaging. Some characteristics of a traumatic brain injury will vary per individual, and each will display different signs and symptoms. Neurobehavioral changes can be immediately following the injury, and you may see a change in the person's emotional function. You often will see a change in a person's frustration tolerance. They may have increased irritability, some mood instability, increased tension or anxiety. Other characteristics that are really common are personality changes, and this can lead to aggression. It can also lead to a lack of desire for the person to engage in past activities that they once enjoyed, or they may have increased suspicions of others. Some somatic symptoms one may experience are headaches, fatigue, sensitivity to light, sleep disturbances, dizziness, and reduced tolerance to psychotropic medication. Neurological signs one may develop are seizures, visual disturbances, or orthopedic issues. A person with a traumatic brain injury is at a higher risk of developing co-occurring mental health disorders such as depression or anxiety. In addition, the person is also at an elevated risk of developing neurodegenerative disorders such as Alzheimer's. A person with a severe traumatic brain injury will likely have difficulty completing activities of daily living and likely will require assistance to be able to live independently. This slide provides more of a visual of the parts of our brain. Our brain is made up of tissue and is protected by blood and spinal fluid. So when one has a trauma to the brain, our skull is essentially being jolted back and forth very fast, and our brain shifts and moves against the skull. This could potentially result in bruising, bleeding, or swelling in the brain. Depending on where the impact occurred, an individual could be affected in a variety of ways, and each individual's brain injury will look different. The front part of our brain is called the frontal lobe, which is this red area right here. Damage to this area can cause changes in one's ability to control their emotions, can impact their executive functioning skills, as well as their critical thinking skills. Personality changes are common, as well as deficits in their motor abilities. This area could also cause someone to lack the ability to plan and organize their day, as well as cause issues with being able to solve problems. The temporal lobe is shown in purple, which is down here in this area. Trauma to this area of the brain can lead to issues with short and long-term memory issues, an inability to understand and process information, and could cause deficits with speech or language skills. Earlier, we talked about post-traumatic amnesia, which is a symptom criteria for a traumatic brain injury. If damaged in this temporal lobe area, it could cause one to not be able to recognize facial expressions, who they are, who someone else is, or other significant events that have occurred. The parietal lobe is shown in yellow and is at the top back part of our brain. Damage here can hinder one's ability to make sense of the world, cause issues with perception, impair someone's senses such as touch or taste, and affect their attention and focus. The occipital lobe is here in blue and is on the back part of our brain. This area focuses on our vision and depth perception. When injuries in this area, it can lead to having blurred vision or blood spots. The cerebellum is in brown and it's very important. It helps with our balance, coordination of movements, and posture. Damage to the cerebellum could cause issues with making connections to the brain, slurred speech, and if an injury to the spinal cord, which is down here, which goes into our neck, it can lead to a person having difficulty swallowing or walking, as well as cause changes in their breathing. This slide is a brief overview of risk factors associated with a traumatic brain injury. Age is an indicator of increased traumatic brain injuries. Although it can happen to anyone, they are most commonly found in children who are under 4 years old and adults that are older than 65. Why, you might ask? These two populations are more prone to falls, which is a leading cause of a traumatic brain injury. Motor vehicle accidents are the second most common way of sustaining a TBI. Other ways are if one is attempting to self-harm, such as attempting to commit suicide. If someone is assaulted or struck by a person or an object, it can also lead to a TBI. So for example, I was working with a youth who was pistol whipped, and due to the magnitude and location of the hit, he suffered from a traumatic brain injury, which decreased his overall cognitive functioning. A common cause of milder traumatic brain injuries are through concussions, which happens more often than not with adolescents and young adults, specifically through sport-related accidents. Doctors have been discussing collisions and blows to an athlete's head that can lead to traumatic brain injuries. On average, over 1 million people a year within the United States sustain a traumatic brain injury, with 50% of them being males. 2% of the population live on a regular basis with an associated disability of a traumatic brain injury. Recovery from a traumatic brain injury varies based on the assessment at the time of the injury, history of the individual, such as have they had prior brain damage, what their past and current neurological functioning is, their age, and if they have any substance abuse factors which could impact their ability to recover. This is my final slide for my portion of the condition presentation. And here is a link that depicts a traumatic brain injury and provides a quick overview, as well as highlights the different areas of our brain that could be affected. Apologize in advance for any dry humor within the video, but I did think it one of the very few videos that gave a whole snapshot of what a traumatic brain injury is. Thank you all for listening.